Our next headline, acetaminophen use during pregnancy may increase children's autism and ADHD risk, a study finds. It says that acetaminophen, commonly sold under the brand name Tylenol and many others, has been considered the safest painkiller for women who are pregnant. And it was a Harvard-led analysis of 46 studies. They had about 100,000 participants, and it suggested that prenatal acetaminophen exposure, or Tylenol, may increase the risk of kids developing autism spectrum disorder or ADHD, but there are also some studies that have not shown a link to that, so we want to make sure that we highlight that. And then it also said that researchers caution that given acetaminophen's widespread use in pregnancy, even a small increase in risk could have significant health impacts. They stressed that pregnant women should consult doctors before stopping medication, since untreated pain or fever also poses risks. And while we have found these strong associations, this article talked about that there were others. There was a Journal of American Medical Association study in 2024 that was funded by the NIH that found no link. But I think what this should do for us all is really have us to pause and think, are we actually going toward these medications out of habit, or do we really need them? And hopefully we're beginning to look not just at the big picture items or the bigger items that we talk about, but we don't really even think about Tylenol or Advil or any of those others as being a health issue because they've been around so long and we've taken them forever. And I think a lot of times we take it for granted. So this is a study that actually opens up our minds to go, hey, Tylenol seems to be pretty harmless as a whole, and that's what we've always heard. But now there are studies linking Tylenol and acetaminophen to ADHD and to autism, which is kind of eye-opening and should hopefully get us to start thinking more about our health in general.